Welcome back, my dear friends. Welcome to my channel. So today we are going to discuss about the second clinical case. So in this case, a 27-year-old woman in her 36th week of pregnancy arrived in the emergency room following an automobile accident. Immediately following the accident, she went into labor. The accident had broken her pelvis. You can see in this picture, you can see the pubic bones have broken, and you can see the sacrum also fractured. So the obstetrician uh, deemed that a vaginal delivery would be hazardous. So a cesarean section was performed. So resulting in the delivery of a healthy baby girl. During the operation, the obstetrician used Pfannensteil incision, that is to open the abdomen. The horizontal incision usually give that horizontal incision, not only horizontal, it is convex. So that large cut has been done to deliver the child at approximately above the pubic hairline. Now here you can see the Pfannensteil incision. This is how the incision has been given. Now what are the questions can be seen? So the first question is, what abdominal wall layers must be incised at the pubic hairline, near the midline, below the umbilicus, in order to access the abdominal cavity? Now moving to this Pfannensteil incision, where we have given, it is given below the umbilicus and below the arcuate line. Now this is slightly convex. So what are the layers you can identify? So the first one is the skin. Then beneath that, you can identify the superficial fatty layer called as campus fascia. Beneath that, we can identify the membranous layer called as carpus fascia. Beneath that, first we can identify anterior layer of rectus sheath. Anterior layer of rectus sheath. Now, beneath that anterior layer of rectus sheath, these vertical muscle fibers, those are nothing but your rectus abdominis muscle fibers. So, those fibers we have to retract them laterally. Then, after that, we can identify the posterior layer of rectus sheath, that is a fascia transversalis. Then beneath or below that fascia transversalis, you can identify parietal peritoneum. So these are the layers can be seen in this Pfannensteil incision. So what are the layers we are going to pierce and enters inside? Now, second question is, why is the incision made in a convex manner instead of straight across? So why we have to give that incision convex? Because try to see here in this first picture, you can identify external oblique abdominis muscle fibers. So they are oblique, therefore running forwards, downwards, and medially. Now beneath that, you can identify internal oblique muscle fibers. Those are running upwards and medially. Then beneath that internal oblique abdominis muscle fibers, you can identify transversus abdominis muscle fibers. Those are running transversely. Now we are concentrating below the umbilicus, above the pubic hairline. So what are the structures can be seen? Now in this picture, you can identify in the first picture, you can identify the segmental nerves which are running obliquely along with the muscle fibers. So if you give a transverse cut, you may cut any segmental nerves. Any segmental nerves leads to post-operative paralysis of this abdominal wall muscles. And also you may cut the important blood vessels over here in the abdomen. So that's why that Pfannensteil incision is convex, not horizontal. It is convex, or it is also not vertical. So in these three pictures, you can identify, in the first picture you can identify the segmental nerves. In the second picture, you can identify the veins which are present in this abdominal wall below the umbilicus. In the third picture, you can identify the arteries which are present below the umbilicus. Now the third question is, what vascular structures might be cut during Pfannensteil incision? Now try to observe here, below the umbilicus, above the pubic hairline, you can see these veins. So what are the vessels can be seen? Superficial Here you can see the superficial epigastric artery. Sorry, here you can see the superficial epigastric vein in the first picture. In the second picture, you can identify superficial epigastric artery. And here, towards medial, here you can identify another artery called as inferior epigastric artery. Inferior epigastric artery. So this inferior epigastric artery, superficial epigastric arteries, the major arteries can be seen. From this inferior epigastric arteries, the pubic branches which are coming from here, those are present in this uh, region below the umbilicus above the pubic hairline. So you may cut any of these vessels, so you have to be careful while you are giving this Pfannensteil incision. Now the fourth question is, where in the abdomen could a surgeon make a large vertical incision with minimal detrimental effect? So the vertical abdominal incisions may be made at the midline. Let us see that. So here you can see there is a midline incision. So midline incision through the linea alba, and also 2.5 centimeters on either side of the midline, that is called as paramedian incision. If it is given at the midline, that is midline incision. If it is given the parallel to this midline, that is called as paramedian incision. If a paramedian incision is chosen, the rectus abdominis muscle can be retracted laterally. After the incision on the on the anterior rectus sheath, this exposes the posterior rectus sheath and prevents the damage to rectus abdominis muscle and its innervation. So that's how we can prevent the cutting or damage of the nerves, and we can preserve the structures. So that is about this second case. After this, we are going to discuss in detail about different cases. So see you soon with the new class. Bye bye.